Hello, everyone. Good evening. Thank you all so much for joining us for today's session. So today's session is a very special session. Today is World Heart Day. So we have a very special session on heart health and diabetes for all of you. So we'll be starting the session very soon. But for us, today's session, we have Coach Kirti. So she is here, to take the session for all of you and educate you all on heart health and diabetes. So Kirti has, been a part of Sugarfit for almost a couple of, months now, right? And she is also a nutritionist and a diabetes educator, and she has a lot of users in Sugarfit here who have seen tremendous results and have reversed diabetes. So she'll be taking us through the entire topic today. So if you have any questions or any doubts anytime, you can always go ahead and just leave all of your questions in the comment section. And at the end of the presentation, we'll be taking up all of your questions. So stay tuned and we'll get started soon. So Kirti, I think you can go ahead, introduce yourself and start with the presentation.
Yeah, thank you, Shifa. Thank you for the very welcome introduction. So hello, everyone. Good evening. So it's been 9 years I'm practicing as a dietitian. Yes, and it is today's World Heart Day. So we are discussing many points together, and if you have any questions, so we are giving answer for them also. So Shifa, can I share my presentation, or it will take?
No, I think we can get started.
We can start.
Go ahead and get started.
Thank you so much. I hope the screen is visible clearly. Okay.
Yes,
so
we can see yours.
Great. Thank you, Sifa. So, good evening, all. So, if you have diabetes, your risk of developing cardiovascular disease is more than double that the general population. And this is said by American Heart Association. And the past 3 decades, the number of heart diseases increases to 150%, which is very huge number in our even our country. Actually, this is going very higher and higher, and we are second in world with diabetic people. Actually, this is also increasing day by day, and with diabetes, yes, we are more prone to having heart related issue, and we want to prevent ourselves from heart related issue. It is very important that we pay attention on our blood sugar levels also. So I will be discussing with you a few points how this diabetes is correlated to your heart disease and what all preventive measures you can do for managing this. So how does diabetes affect your heart? Yes, high blood glucose level, high blood pressure, and cholesterol. So you must have been thinking, or it's in your mind, that what happened when the high blood sugar is there? Why do you get heart related issue or with high blood pressure or cholesterol? So I just wanted to tell you, when the blood sugar is very high, so what happened, the metabolism of glucose will affect. It means your cells not taking proper glucose, and you will end up having too much glucose in your blood. So what happens, cells need energy. And for that energy, what happens, cells start using your body fat for a source of energy. And that what will happen, you will start releasing extra fat in your blood also. And this extra fat damage your arteries, or it can go and accumulate in your blood vessels. So that is why when the high blood sugar is there, so the metabolism of fat, the fat utilization will change in your body, and you will be end up having too much fat also in your heart vessels. So that accumulation, that maybe you have heard many times that the plaque formation means the arteries got blocked or vessels got blocked. That problem may you have heard many times. And one more thing, when the blood sugar is very high, what happens? Your blood will become very sluggish, very thicky, or it become very like like very thick actually. So the thickness of blood also impact our blood vessels. The blood should be flow properly, and blood is not flowing properly when it comes to high blood pressure. And when what happen in high blood pressure, the blood will not flow properly in high blood pressure, and this problem also can damage our heart muscles or heart vessels or arteries. And yes, the cholesterol. So when we have high blood sugar, high blood pressure, the cholesterol is end product. And may you have seen, when the people have high blood sugar, they end up having too much triglyceride in their blood. The same process, because the body is not using glucose and body wants energy, so it start using the fat you have in your body. And that is why the protein utilization also will not happen properly, and you will end up losing your weight also, and you will see your weight also losing very fast, and muscles also you are losing. So this is the process happen in body, and this affects your heart. Yes. So what you can do preventing yourself, and you can make yourself aware for preventing related heart disease. HbA1c test. So average blood glucose level over the past means try to manage your blood sugar level, HbA1c level below 7. This is 3-month blood test. So try to check your HbA1c level every 3 months, and check you are not you are achieving the target of below 7%, which is very important if we don't want any complication related to high blood sugar. Okay. And when it comes to blood pressure, yes, try to check your blood pressure regularly every day, and take your medicine regularly, very important, and try to achieve the target of your blood pressure is below 140, means it should be like in between 140 to 90. We say systolic and diastolic blood pressure. And yes, very important, check your cholesterol level. If you checking your blood sugar regularly and it is coming above 250, and always it is going in higher range, 250 or 300. So check your cholesterol level also always. That the buildup of extra cholesterol can happen very easily when you are not monitoring your blood sugar. The other factor is smoking. Yes, smoking and smoking, what happens when you're smoking or stressed out? Not only smoking, when you are stressed out, what it will do, it will put the pressure on your blood vessels, which help to flow the oxygen-rich blood in your heart and other part of area. So damage can happen when you are smoking, and the nicotine and the compound found in this cigarette, very danger, and damage your blood vessels very easily, which is very important for proper oxygen flow. So I would say checking your HbA1c every 3 months, it is very important. So you can keep the target of below 7%. So yes, protect your heart with healthy eating plan. So very important, diet play very important role. So try to include fiber-rich food item, increase your vegetable intake, eat regularly salad, and avoid too much of oily food items. And that too, we have actually 2 types of fat in our diet, good fat, bad fat, but healthy eating plan, which you can just balance your meal more and more. Fill your 50% plate with fiber-rich food item, which is very important. And the other thing you can do is try to add good fat in your diet. You have to understand, like eating balanced diet is always beneficial for managing all health related issue, managing your blood sugar. And yes, healthy eating plan is always helpful. It is the easiest way and the fastest way you can manage your blood sugar. Increase the fiber intake, always focus on lots of fruits, vegetable and salad. Physical activity, yes, you have to avoid when the cholesterol is very high, avoid doing any high intensity exercises. But what you can do, walking is the most important and first exercise you can do for maintaining your heart health or blood sugar also. So what just doing regularly 30 or 45 minutes walk is very helpful. So do regular walking. It is very important for you, for maintaining good heart health. Walking is very wonderful. Healthy weight, we have seen when the weight increase, automatically we get to know, okay, we have higher blood sugar, higher blood pressure, or the cholesterol also is going high. So maintaining healthy weight is very helpful for if you want to come out from all these issues. Quality of sleep, if you are doing everything, if you're not sleeping properly, it is very difficult to manage each and everything. So what happens when you sleep properly, your organ will work, and they will do some recovery work in between. If you are not sleeping properly, then what happens? Your blood pressure also may increase, and the blood sugar also. We have seen in many cases, if the sleep is not proper, the blood pressure and the blood sugar, both we have seen it increasing day by day. So sleeping on time and taking proper sleep is very important. If you're following diet, exercise, if you're doing many things together and the sleep is not proper, will not be seeing good results. So it is very important that we maintain good quality sleep. And none other than is stress management. So yes, stress, when we stress, we release so many bad hormone, which is not good for us, and the stress lead to high blood pressure, and high blood pressure is, yes, it is very harmful for us if we are not managing it. So doing yoga or doing regular walk or doing your favorite activity can manage your stress, or maintaining good sleep also help you manage your stress. So be active and try to manage your stress as much as possible. It is very helpful. And yes, if you have habit of smoking or alcohol, yes, the harmful compound found in the cigarette, nicotine and other, it is very harmful for us. The first thing, what happened, the long-term smoking, what will happen, it will damage our blood vessels, and we will end up having atherosclerosis, means the plaque formation in our blood vessels. So that this also can happen. So yes, we have to see then the smoking, we have to stop smoking. It is very important if we want to prevent ourselves from heart-related issue. If you do not have blood pressure, if you do not have diabetes, if you do not have any other health issue, but if you are smoking, yes, you have very much chances to getting heart-related issue. This is very important. Yes, so we'll be just clearing some doubts. So how does cholesterol affect heart health and diabetes? Okay, so cholesterol can contribute to the formation of atherosclerosis. So this is just nothing. When you have veins, so there will be a blood is flowing inside the veins, and may you end up from some obstruction, means there is some hard, we can say cholesterol will stuck in between your veins and the blood flow will not be proper. So we want the blood flow should be proper in your veins, in your vessels, that should be proper. So cholesterol is very hard. So what will happen? It will stuck in between your arteries, and yes, it impact the blood flow, and we end up having this problem, cholesterol and heart health. Okay, so poor heart health, especially condition like obesity and atherosclerosis, can lead to chronic inflammation, insulin resistance. Yes, so what happens when the high cholesterol is there? So definitely it will impact other organ also. So it will impact our this pancreas organ, and the insulin is a very important hormone when it comes to manage our blood sugar. So it impacts their function also, and we can get insulin resistance. So what is insulin resistance? Means the cells are not getting proper response to get the glucose. Actually, insulin work as a key. It open the cells and the glucose will enter in the cells. But if insulin is too much, cells will get to resistance, and thus will end up having too much glucose in our blood, and which is again the cycle will continue and will get weight gain if insulin resistance is there, and then again the cholesterol will increase and will end up losing muscles, and the blood pressure also start going high, low. These kind of symptoms we'll see. Okay, what is the connection between diabetes and heart disease? Okay, especially type 2 diabetes. We have many conditions in diabetes, but now we are talking about type 2 diabetes. Is a significant risk factor for heart disease. High blood sugar level can damage blood vessels. So same I told you, when there is too much sugar in our blood, it is getting affected each and every way. So it will damage our blood vessels over a time and increase the risk of heart attack, stroke, and other cardiovascular complications. So how it happened, I told you in starting, when the blood sugar is very high, either the fat will be very high in your blood, or the blood will become very sticky or sluggish. So these things can damage your heart vessels. How can I lower my risk of heart disease? So yes, it is not only one thing that you will be following only diet, so things will work out. You will only stop smoking, so things will work out, or you will lose only weight, or you will only focusing on one thing. It will be hard to say. Actually, we have to work holistic. So we called holistic approach. So what? Yeah, everything is important. You have to walk regularly. You have to eat fiber-rich diet. You have to eat balanced diet. And you have to be stress-free, try to be stress-free, and you have to be manage your sleep also. So there are actually many factors who work together. So maybe is coming to your mind why some people get this heart-related issue and why some not. So actually there are many factors related to a person when the person will get heart-related issue. So those we are not aware. So yes, so please do regular checkup. It is very important, and work on each and every part. It is lifestyle changes. It is not only working on one thing. Do your checkup regularly and keep track on your blood parameter. Either it is blood pressure or blood sugar. Keep checking all the parameters. If you will track your parameters all the time, you will be knowing, okay, what is happening, and you can consult with doctor or your dietitian. So you can go ahead, okay, if your blood pressure is increasing or blood sugar is increasing, try to connect your health professional, so they will guide you, okay, how you can manage this. So it is very important. The first and foremost thing, regular checkups. Regular checkups play a very important role when it comes to management of any health related issue. Okay, so how so the other thing is how you can support healthy heart through diet and manage diabetes. So okay, so yes, same thing I would say, ki focus on the diet which is rich in vegetables, whole grains, and good protein, healthy fat like those found in nuts and seeds and olive oil. Limit saturated fat. So maybe you will be having some doubt regarding saturated fat. What is saturated fat? And you have heard many times we should be avoiding fat. Fat nahi lena hai, fat nahi lena chahiye. Like that, many doubts you have. So I just want to clear a few doubts regarding fat. So we have two variety of fats actually. One is good fat, second is bad fat. So good fat comes with natural sources like nuts, seeds, coconut. If we eat coconut and seeds, so these comes in good fat category. And the bad fat, we are eating packaged food, the oil, we are reheating the oil and we are eating like samosa from outside, example. And at home also, if you are reheating your oil and using it again and again and again, this oil is bad for you. Yes, if you are eating too much non-veg, yeah. So non-veg is, if you're eating too much non-veg, it also comes in saturated fat category. So, and the bakery item also comes in saturated fat. We eat lots of bakery item that also comes in saturated fat. So the oil will not be visible, but it is in saturated form and we are eating it. The taste is very nice. And end of the day, it is impacting on our blood, heart health and diabetes both. So consider food which is rich in omega-3. If you're non-vegetarian, prefer fish, eat dry fruit only for healthy omega-3, because omega-3 play a very important role for protecting your heart actually. And yes, omega-3 will reduce, it is good fat, HDL. So it reduces your bad fat level also. The fat is always not bad. Do not avoid all fats. Yeah, fat is bad, but which fat is bad, which fat is good, that you need to understand. It is very important. And regarding diabetes also, when it comes to managing your diabetes and we want to protect our heart from diabetic related complication, so same thing, protein is very important. When you eat good amount of good quality protein, vegetarian protein or non-vegetarian protein, then yes, definitely the blood sugar will be managed. And end of the day, if your blood sugar managed, you will not be having any heart related issue related to diabetes. This is also very important. Okay, how much exercise? Yes, recommended for heart health. So the American Heart Associate recommended at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week, combined with muscle strengthening activity at least 2 days a week. Make sure to form an exercise routine under a professional guidance. Yes, if our blood sugar is very high and with blood pressure or blood sugar, if the cholesterol also is high, it is very important that we see what exercises we are doing. Walking, there is no harmful impact of walking, but you have to understand that without any professional help, you cannot do any vigorous activity. Muscle strengthening is very important, but sometimes what happens when we do vigorous activity, it lead to some other complication related to heart or the diabetes. The blood sugar can go very high or the blood pressure also can increase. So you have to be very careful when you're going to do any kind of high intensity exercise. Do it in some take some professional help when you're doing high intensity exercise. And yes, walking or fast walking, yes, it is safe to do. And you can do 45 minutes or 1 hour you can do, but start with 30 minutes or 20 minutes, then you go with slowly, you can increase the intensity, but do not suddenly start with any fast or high intensity activity. It is not good for you. And always start your activity with light walking, and walking is always safe and anytime you can do, and you can get lots of benefit by walking easily. Very good, actually. Yeah. Okay, so what should your target blood sugar level if you want to protect your heart? Very important, actually. We have seen many cases when the blood sugar is going high and the heart issues also arises, and we are seeing very frequently these things because yes, this diabetes is causing the first number is diabetes, which is causing heart related issue. So yes, as I said you, the HbA1c, we are doing our 3-month blood test in a once 3 months. This is HbA1c test. It should be less than 7. In Sugarfit, we have target of 6.5. We are achieving target of below 7, actually 6.5. So you try to check your HbA1c every time. I'm saying you again and again, it is very important that we maintain our HbA1c level below 7. So we can prevent ourselves from the complication which is arising to give you heart disease. So it is very important that you check your HbA1c and it should be below 7. Try to set the target below 7 if you want to protect your heart health. Very important. Question and answer. Yes. So we can take some question. Yes, super.
Yes, definitely, Kirti. Thank you so much for such a wonderful presentation. I think you can move on to the Q&A now. So if any of you have any questions, feel free to drop your questions in the comments and we'll be taking up all of those now. So there is a couple of questions, Kirti. So one is by, this is basically, okay, they're asking, should potassium-rich foods be avoided when your sodium levels are low?
Sodium, yes. So we have to keep on check our sodium level. What happened actually? So today sodium is different, tomorrow is sodium. So it's depend upon the condition. When the person have high blood sugar, so sometimes we see the variation in sodium, potassium level. Yeah, excess potassium food item we can avoid, but taking in limited, normal, when we cook the food items, though the potassium will leach out, most of the potassium. So yes, you cannot eat too many fruit together. So that you need to be considered. Otherwise, taking potassium through the cooked food and with increase with you can balance the sodium and potassium and it's good to go. Yeah, you have to avoid drinking like if you're drinking nariyal pani or coconut water too much, or if you're eating in a day 4 to 5 fruits, this may create some issue. Otherwise, taking normal food, cooked food is absolutely fine to take.
Got it. Thank you. So the next question is by Mr. Mahesh. So he's asking that if a person with diabetes is underweight, then should they also reduce weight if they want to reverse diabetes?
No. So we have to understand what is the cause of weight loss. This is muscles loss, fat loss, or it is anything else. So there are conditions why do you lose weight when you are diabetic? So we have to understand the cause. No, we have to increase the muscles count. And not required more weight loss actually. You have to increase your muscles mass and we can increase the weight if the weight is underweight. If you are underweight, suppose. So we have to increase your weight by giving you balanced diet and giving you good calorie, which will not increase your blood sugar again. And yes, we have to work on your muscles count, which is very important because the weight loss happen because of you had loosened already excess muscles. So we have to work on your muscles count and automatically you will gain some weight, good weight, and will not work. You no need to lose more weight actually if you're already underweight.
Got it. Thank you, Kirti. So the other question, this is by Mr. Taran. So he's asking, will drinking alcohol increase heart issues and does it impact diabetes? His current sugar levels is around 10.6.
Yes, very much. So what happened when we drink alcohol? So end of the day, it will go into our liver and there is too much glycogen. And yes, it will create insulin resistant. It will impair the our fat and we have macronutrients, we have glucose utilization in our cells. So end of the day, when the alcohol intake is high, yes, it will impact on your liver health. And if your liver health is not good, your HbA1c is going to increase end of the day. So alcohol is, yes, very much related to higher blood sugar. So we have to limit the alcohol intake and we have to see what is the safe intake. We have to talk to professional and yes, you have to reduce intake of alcohol because continue taking alcohol with impact on liver health, and if liver health is not okay, you are increasing your blood sugar level also. Very much so.
Thank you, Kirti. So the next question is from Miss Ujwala. So she's asking, is milk good or bad for people with diabetes?
Yeah. So milk, what happened? We are giving milk product, but milk we are saying no. Why? Because milk has a lactose sugar is very diluted form. So we have one CGM device and we are checking if someone is drinking milk. So what is happening with them? So this is just in a live example. We are seeing when someone is drinking milk, what is happening. So when someone drink milk, if the blood sugar is 100, it reaches to 200 or 300. So why it is? Yes, milk has a very simple form. Lactose sugar is then it will absorb in our blood very fast and we'll see very fast rise in our blood sugar. So yes, if the person is diabetic, we recommend it to them not to take 1 glass milk or milk every day. We say sometime if they feel they can take half a cup milk, or sometime we have to say no to milk only. We tell them to go for almond milk or soya milk or some other source of milk. But yes, milk, we have seen increase in blood sugar levels when someone is taking milk. So we have to restrict the amount of milk, or sometimes we have to avoid it also, which is good.
Got it. So the next question is by Miss Lata. So she is asking how much of nuts and seeds can we take in a day, and what is the best time to take them?
Yes. So nuts and seeds are superfoods. They have lots of benefit, and you should be eating every day. Actually, everyone, if person is diabetic or non-diabetic, heart-related issue or not, they should be eating nuts every day. So yes, per day, 6 to 7 nuts are safe to take. They can change the variety, not the kismis, walnut, almond, and pista is safe to take. And time, if I would say, yeah, empty stomach, they will work wonder, and you soak it or roasted it, then you take it, because the nuts have some anti-nutritional factor also. So when we soak it or we just roasted it, the absorption will be better. And yeah, evening time you can take, evening with fruit you can take. So evening, like if you're drinking your tea and you're not eating anything with your tea, take dry nut, 6 to 7 dry fruits with your tea, or you can take with morning tea also. Avoid taking with your food. Maybe you end up having too much calorie if you're eating with your food. So nuts can go good with along with tea or as a snack, or can be taken with fruit also. If you are eating your 11 a.m. fruit or 5 p.m. fruit, then definitely you add some nuts, gives you lots of benefit.
Got it. Thank you, Kirti. So the other question is, are sweets harmful? Their sugar levels are 115 mg per dl.
Didn't get you. Can you ask me
So
again?
their sugar levels are around 115 mg per dl, and they're asking if sweets or consuming or eating sweets, are they harmful?
So we have to see like how much sweet you are eating, and the consumption of sweet, the frequency of sweets. So if sometime you're eating a little portion and you're not eating with your food, maybe it will not harmful for you. But yes, eating sweets regularly, long term will increase your blood sugar level. So the sweet you are eating, what time you are eating, and how's your lifestyle, and that also depend. So yes, would say always keep safer amount. If you're eating something like sweet, you have heard everywhere sweet will increase our blood sugar. So try to limit the sweet intake and do not eat with your food, and always avoid yourself eating too much or too many sweets over a time. That may increase your blood sugar.
Got it. Thank you, Kirti. So we have a couple of other questions on HDL, right? So they're asking, how can you increase your HDL? And if the HDL is very high or higher than the recommendation, is it okay? Is it harmful?
Yeah. So see, we want always things to be in normal value. The HDL, yes, HDL. If you want to increase your HDL, yes, the eating the food which is rich in omega-3 help in increase HDL level, like nuts or fish or seeds will manage HDL level. Yeah, if it is very high, then yes, it is also harmful actually. So we have to keep the HDL level in normal range. Everything is in excess is bad, so HDL also have some side effect. So we want that HDL also should be in range, LDL should be also in range. If your HDL is high, you have to understand what is causing this HDL high. Are you taking too much omega-3 food item? That you have to see, and you have to seek some professional help, and you have to discuss about this. That if the HDL is very high, what we can the health professional can suggest you how you can bring it to normal range. And yeah, seeds, omega-3 of fish is good source of managing your HDL level.
Got it. So another question basically is, they're saying that they have lost all of the energy levels after a 2-year COVID period. And what exercises are recommended for regaining energy levels and muscle strengthening? Do you recommend
Yes,
any
yes.
suggestions, any exercises for that?
Yeah, actually it's very much depend upon the person that are they facing any health issue or not, and what was the reason. Because of, if only the COVID, because that they have lost their energy. So yes, the balanced diet, increase the protein intake, see how much protein you are taking. And the other thing is exercise. Yes, muscle strengthening exercise is very important. Then only you can gain the full energy. So yes, we call muscle strengthening, muscles building exercise, lifting 5 kg weight, also very important. So if you have some exercise professional or someone who is very experienced, you can ask them to give you some exercises. Walking and doing little home exercises also will, yoga also will help regain our energy. So it is, you have to be more active throughout the day. That's also work, improve your energy level. So what you can do, you can more focus on muscle strengthening exercises, which will help you so much for gaining your energy again, build your muscles, more muscles. And yes, start with normal walking and cardio activity, and then you can go with muscles activity. So this will help you so much for gaining your muscle. And regarding diet, I would say yes, protein play very important role. With each and every meal, try to increase your add your protein with each and every meal, and increase your protein intake. If you're eating less protein, that also can cause. And drink enough water, get proper sleep, because only eating, then again the same thing comes. You have to see whole thing, that you're sleeping properly or not. Because if you're not sleeping, then also you will feel very drained. You will not be having any energy. You're eating properly or not. So many things we have to consider here.
Got it. Thank you, Kirti. So a couple of other questions are there, so I'll just take them as well. So there is another question. They're asking, can people with diabetes take Karela or Jamun juice? Is it good for, reducing sugar levels?
If I would say, if only Karela and Jamun juice and throughout the day you're not doing anything, it will not make any sense. So these things is very helpful if we are doing it with other lifestyle changes. Suppose if you are taking Karela and Jamun juice, and you have taken Karela Jamun juice early in the morning, and breakfast you are eating something which is rich in carbohydrate again. So that Karela and Jamun juice make only 1% difference. So it is, again, it comes with other lifestyle changes. The Karela and Jamun juice is, or apple cider vinegar, or you go with lemon water. These are support system. We get support from extra support with them. But the only thing is, when you're drinking Karela Jamun juice, it is very important that you follow your diet also. You do exercise also. So you will get extra support from these things. If you're taking only Karela Jamun juice, and throughout the day, if you're not doing exercise, you're not following diet, then this Karela Jamun juice will not make any difference so much. Maybe you have to drink so much, or for a longer time, little difference you will see. But these kind of support is very important if you are managing Karela Jamun juice with other lifestyle changes. This is also very important.
Got it. So other question, Kirti, is Okay. So what is an oil that can be taken for people, for basically for if they are someone with a heart condition, is there any good oil that they can take, or which oil is more suitable for regular cooking?
Okay, so oil, actually we have variety of oil. So any oil is in excess is harmful. If you are using oil, try to use cold press oil. Okay, and avoid refined oil. If you're using cold press oil, that also we have to use in not in larger portion, like in a month, a person recommended 1 liter oil only. So you have to see that you are drinking, you are using 1 liter oil for your cooking for a one person. If suppose at home you have 3 persons, so 3 liter oil should be consumed in a month. So actually, whatever oil we are using in excess portion. And when it comes to quality of oil, or so we avoid refined oil. We have a rice bran physically refined oil, which we can use, but not on a very large portion. We have to limit the portion. And yes, the cold press oil also we can use, but we have to see, we should not be using oil in a very large quantity. That we have to avoid. Or refined oil, we can avoid using it. Other than all the cold press oil, all oil available is safe to take in limited portion. And the other thing is, at home also we are doing frying, so we are using same oil again and again. So whichever oil it is so good oil or bad oil, if we are doing frying again and again in any oil, it will become bad for you. So avoid refined oil, use any good quality cold press oil, and avoid using frying in same oil again and again. Otherwise, it will become bad for you. So that you have to see. And yes, always limit the portion of oil. Whatever we are getting from outside, it has some chemical.
So the next question, Kirti, is by Mr. Rajiv. He's asking, can I play badminton for 30 to 40 minutes daily morning instead of walking? Is it fine if his HbA1c is around 7.6?
Yes, 7.6. So, Mr. Rajiv, you have to see what is your cholesterol levels. Your triglyceride is how much. If the cholesterol level is very elevated, you cannot take the badminton. Need lots of actually intensities, require lots of intensity. So if your HbA1c is below 8, you can play badminton early in the morning, but don't go empty stomach. Eat something half an hour before, or 15 or 20 minutes, very light food, like half a fruit you can eat, or some dry fruits you can eat, and or you take some lemon water and then you can go. And the other thing, keep it in mind, check your cholesterol. If it is not very high, then it is safe to play. If you do not have any other health related issue, safe to play.
Got it. Thank you, Kirti. So another question is, they're asking, is eating fruits in the morning good for diabetes management?
So I would say with my experience, we have one CGM device, and we are seeing many different kind of diet and what is the impact on your blood sugar levels. So it is very much depend upon person to person. But one thing I would say, ki when we start our day, if the person don't want to elevate their blood sugar, we avoid fruit actually, because fruit has fructose sugar, and it is sugar only, and it will go into our liver and it work as like alcohol only. So we'll avoid taking fruit early in the morning. If possible, we have to avoid it actually, and we can start our day with protein rich food item, which is good thing. Fruit can be taken 11 a.m. or evening 5 p.m., which is good thing. But taking fruit early in the morning will not help to manage your blood sugar. So you will not see rise, you will not see lower number also. So starting your day with protein rich food item, what I recommended and what we are seeing is making good impact, rather than starting day with fruit. And fruit also, in diabetes, we have to limit the intake of fruit. It should not be more than 100 or 150 grams. If someone with diabetic eating too many fruits, they have to restrict the amount, because fruit has fructose sugar, which end of the day go into the liver as a glycogen, and it will also increases our HbA1c level. So limit the fruit intake and avoid taking fruit if you are diabetic early in the morning, empty stomach. Yeah, Shifa, can you hear me?
Hi, Kirti. I think she had an
Yes.
issue. I'll read out the few
Okay.
questions for you. Give me 1 second.
Yes, yes.
Yeah. Another question is from Kunal. He asks, if urine test shows trace of protein and sugar, what should one do?
Yes, so yeah, you have to see that if it is showing protein, means you're leaking protein through your kidney, means the blood sugar is very high. So we have to understand the situation, what is causing it. Can cause due to other health related issue also. So when you will do other tests and will check other health related parameters, so you will come to know. But what we have seen is this condition arises when the blood sugar is very high. So they have to manage their blood sugar. If the blood pressure is going high, they have to manage the blood pressure. So this condition can be managed by the managing condition because of this thing is arising. So this we need to take care. If we are seeing some traces of sugar or protein in the urine, if it is causing because of high blood pressure or high sugar, then we have to manage these conditions. The automatically will not be seeing the traces in urine. We have to, yeah.
I mean, you can continue, Kirti.
Yeah. This was the simple.
Okay, got it. So another question is by Mr. Oscar. So he's asking, is it okay to consume ghee every day for diabetes?
Yeah, it is okay to take, but how much you are taking, that also you need to take care. 2 teaspoon ghee is safe to take. Ghee is very good. And if you're taking in limited portion, it has lots of benefit. It reduces the glycemic index of the food, but taking excess ghee also can cause issue. So you take 2 teaspoon ghee per day. It is safe amount to take, and you will get benefit from it. It will help in reduces the glycemic index of the food. Suppose if you are eating your chapati, use ghee. If you're eating your idli, use ghee. And see, in a day, you are not exceeding more than 2 teaspoon ghee per day. It is the safe amount you can take every day.
Got it. Thank you, Kirti. So another question is, okay, this is basically on rice, right? I think everybody will have this question, but is it okay to take white rice in a limited quantity, or would you recommend, like, what is your suggestion for someone who is, regularly taking rice? Like, do you have any suggestions?
Okay, or they don't want to leave the rice. I love eating rice. So how you can eat rice? Yes, the safer amount is like the fistful rice you can take, and how you can eat rice so you will not end up having too much blood glucose. Always eat your the rice quantity. Suppose you have 1 small bowl rice you are eating. So take this same amount of vegetables with you, with rice, eat salad, and add lots of protein with it. So then it is safe to take. If you're eating only rice and little rice also, if you're not eating with vegetable, if you're not eating with salad, if you're not eating with protein, then yeah, it will impact on your blood sugar. But if you're eating rice, what is the safest way to take rice? Always limit the rice intake. And if you're taking this much rice, add double the amount of vegetable, add salad also, and keep some protein also with the rice. Then it is safe to take. Yes, and avoid excess amount of rice. This will again lead it to increase your blood sugar. But always eat your rice with lots of vegetables, salad, and protein.
Got it. Thank you, Kirti. So another question is, what can we take for vitamin D deficiency? Is there any particular food we can eat?
If I would say the food is, yes, very difficult. We do not have many options, and actually we do not have option for vitamin D. So the supplements work best, and yes, the sunlight. So food, there are no particular food which indicate that, okay, if you eat this food or food, the vitamin D level will arises. No. we have to depend on sunlight and yes, on supplement. But food, we haven't seen any significant result increasing your vitamin D level with food items, not as such.
Got it. So another question is, Kirti, so for someone who is, having diabetes, is it okay to practice intermittent fasting?
We have to see that the intermittent fasting can lower than blood sugar below the range. What is safer range is 70 mgdl. But if you're doing intermittent fasting, it is very important that you do under some professional, because what can happen when you are diabetic and you're doing intermittent fasting, your blood sugar can go very low also, and which is very danger. So what is your HbA1c level? And because if you're doing intermittent fasting, what food you are eating when the fasting is not there, and the fasting window, what is the window, 14 hours, 16 hours, 18 hours. So it is very actually danger if someone is doing intermittent fasting in diabetes without any help. Actually, intermittent fasting in diabetes is very helpful, but you should be knowing your body is capable to take this or not. Your blood sugar should not go in lower. And if you're doing intermittent fasting, how many hours fasting you want to do, 14 hours, 16 hours. The other thing is, if you're doing intermittent fasting, your nutrients should not be disturbed. You should be eating proper nutrients also, the eating window. That time you should be eating proper nutrients also, the carbohydrate, fat, protein, and micronutrients should be there. So it is very important that you do intermittent fasting, but with some professional help only you do. If you are diabetic, suddenly you should not be starting intermittent fasting without someone help. It can be very dangerous. It can lower your blood sugar too much.
Got it. So another question was, Kirti, since you, I think, spoke about salads, they're asking, what is the importance of taking salad? How does it help us?
Okay, it is not about salad or vegetable. I'll tell you one thing, is fiber only. So what happened, why we are telling, okay, eat vegetables, eat salad, eat vegetable. So nothing, we just want to give you more fiber. So what fiber will do? It will form as a gel in our stomach or intestine, the fiber, and it will collect all the toxins. Toxins means it will collect your extra blood sugar, extra cholesterol, or even though the cancer related, who can create the cancer also, the toxins it collect, and it will throw out the stool from our body. So it is not about vegetable or fruit or salad. It is all about fiber, natural fiber. So you will eat fiber, you will releasing more toxins from your body, and you will releasing extra sugar and whatever the bad pollution, and you are drinking water and you're eating bad food. So if you want to prevent yourself from all these things, eat lots of fiber, means eat lots of vegetable and salad. We have this in option, actually easy option to get lots of fiber. Yeah, Shifa, am I audible?
Yeah, Kirti, I'll just ask you the next question and then we can.
Yes.
Yeah, 1 second. Okay, this is by Nisha Nigam. Is it okay to have 2 chapatis of wheat atta in a day, or do you recommend some other type of atta for chapati?
If you're diabetic and your blood sugar levels are going high, then yes, we can avoid wheat chapati, and you go for atta which contain other grains also, because wheat has gluten, and gluten we haven't seen any good result managing blood sugar. We have seen it impact on our blood sugar, like we are eating white rice. So yes, adding some chana atta in it, or mixing jawar, bajra, and using less wheat atta and more other grains is very more beneficial actually. Or someone can stop taking wheat roti and go for other grains also, jawar, bajra, or besan ka chila. But if you are not comfortable avoiding totally wheat, so what you can do, you just mix other grains in your wheat atta, soya bean, besan and jawar and bajra, then eat your chapati. So anyhow, you will not be getting too much like adverse effect from the wheat, what we get from whole wheat. It is not good in diabetes. Actually, we haven't seen any good result.
Got it. Thank you so much, Kirti, for taking all the questions. I think we're almost, at the end of our time. So I just want to thank you for, taking this wonderful session for us and educating us all on, this World Heart Day. So thank you so much for your time. And I just want to thank all the audience as well for asking such wonderful questions and being very patient with us, and also to Kirti for answering all the questions so patiently. I hope all of you learned something new from today's session and, implement a couple of these tips that, we have shared today in your, daily life as well. I'm sure that's going to help you a lot. But yeah, that's about it. Kirti, is there anything you would like to say before we end?
No, I just want to say that, yes, keep yourself active, be healthy. And yes, we are Sugarfit ready to help for any, it is not only diabetes. We are here to help you with all health related aspects. So thank you, Sifa. Thank you for your time.
So
thank
much,
you,
Kirti.
everyone. Bye.
Yeah, thank you, Kirti. Thank you, everyone, for joining in. Hope all of you had a great time today, and we'll see you again next, Friday.